Hi there, my name is C.Colson, and this is Professor Dowell's class, Nursing 210. This is our musculoskeletal neurologic assessment, video number 3. I'm here with my wife, Megan. I am unable to do this with any kind of classmates or anonymous participants at this time, given the week situation. So we're just going to roll with it. Megan is also a nurse, specializes in cardiac care and critical care as well. So she is not going to be helping me, but will understand kind of some of the terms that we use today. We need to basically implement a couple other tools. Don't have a tuning fork, so what I've found is our daughter's vibrating elephant, essentially, that gives a certain level of vibration, like so, and then stops. So we're going to use this for our vibration test. Our objects are going to be these here. Of course, we have our sharp and soft as well. And rather than our reflex hammer, which I don't have at this time, I'm going to use the soft rubber tip to my electronic stethoscope. So we're going to go ahead and get started. If I can, I'll go ahead and have you lay down. We're going to start off basically by checking the different rotation angles and range of motion within the body. We'll start off with the hips. We're going to do basic flexion, extension, abduction, and adduction with the hips. So I'm going to have you lift your entire right leg to check for your flexion and extension, as well as putting it down. We're going to go ahead and have you abduct, which is moving out towards me, and adduct, which is basically moving over. We're going to do this against my resistance. So go ahead and have you push up, and then back down, abduct out towards me, and then adduct over. Okay. We would do that bilaterally for both legs, of course. We're going to move on to the knee. While we are focusing on the knee, we're going to go ahead and check for movement also within the hip. So we're going to do basically an internal rotation as well as an external rotation as well. So the internal rotation, we would put the knee over the other knee, and then the external, of course, we would kind of do the, as the video refers to, as the man sitting pose. So we're going to check flexion and extension of the knee as well. So go ahead and do it without my resistance and put it back down. And again, pushing. And you can lift the knee up real quick and push back down. Thank you. All right, we're going to go down to the feet, and then we'll focus on the toes. So with the feet, we're going to start with plantar flexion. So go ahead and start in kind of a neutral position and do a plantar flexion, so push the foot down. Okay, we'll do a dorsal extension and internal and external rotation. So internal, external, and then go ahead and roll your ankle 360. Good. So again, we're going to check with resistance. So go ahead and push down dorsal. Plantar and dorsal. Internal, external, and rolling of the ankles. Okay. We'll check range of motion with the toes and the joints here as well. Go ahead and push your toes down towards me, and then up towards the sky. And can you wiggle them? Good. All right, fantastic. So we'll go ahead and move our ottoman here and have you stand on up. Make sure we're still centered here. So we're going to have you hyperextend the hip. This is just another hip check. So go ahead and hyperextend and do a backwards kick while leaning forward and maintaining balance. Good. Okay. We're going to check the neck with chin to chest and chin to air, essentially. That's going to check for your flexion and, again, your extension. Hyperextension of the neck backwards. We can check for rotation, which is where we're going to look side to side. And then we can check for lateral movement, ear to shoulder. Good. So we're going to do the same thing, chin down, and then go ahead and extend back, and then hyperextend all the way back. Go ahead and move your chin, look towards me, look towards the other way, and then ear to shoulder again. Good, fantastic. We can also look at shoulder range of motion here. We're going to put you kind of in a diving pose and get your hands up over your head. Good, fantastic. You're going to hyperextend, kind of like if I was washing your hair. Keep your hands up. Go ahead and dip on back here. Good. Go ahead and shrug your shoulders down. And we're going to look for rotation, abduction, and abduction of the arms. So go ahead and rotate the shoulders like so. Abduct the arms out, and then go ahead and adduct across your chest. Good. Okay, so we're going to do everything again with resistance. So go ahead and lift your arms up towards the sky, all the way up. Push up against my arms. Good. Go ahead, I'm just going to feel your shoulders as you rotate. Good. Go ahead and abduct your arms. Good. And how about rolling them back towards me now with a hyperextension of the shoulders. Good. And then an adduction towards the front. Good. Fantastic. Okay, so we are going to look at elbows. We're going to do basically a bicep flexion. So you can go ahead and move your elbow, do like you're flexing your bicep, like so. Okay, good. Can you do that against resistance? And then we're going to do the extension the opposite way. Good. Go ahead and show me without the resistance. Awesome. Fantastic. Okay, so we're going to go down, of course, to the wrists. If you can go ahead and look at the camera, we're going to go ahead and have you flex and extend. Go ahead and put your wrists in a neutral position. We'll check lateral movement like so. We'll do a radial inversion where we put your arms out. Go ahead and invert towards the inner side of the wrist like so with both. And ulnar external rotation. Good. Okay. So we'll do the same thing. Basically just extend and flex against me. Ulnar external, radial internal. Good. And go ahead and rotate the wrists. I'm just going to hold on to them. You can show me your wrist strength. Okay, fantastic. Same thing with the fingers. We're going to have you go ahead and push the fingers and up. Keep them in a nice neutral position. We can abduct and then adduct by kind of curling the fingers on themselves like so. Okay. Push against, and then I'm going to put my fingers between your fingers and you're going to squeeze. Good. And everything seems to be strong. There's no deficits at this time. Bilaterally, everything looks great. So at this time, we're going to look at the thorax. We're going to assess for scoliosis. So go ahead and bend over and touch your toes. Just going to check the spine. Megan's range of motion is a little limited due to a recent birth and C-section. The core strength isn't what it should be, so we would note that as a deficit. She can't touch the toes, but there's no scoliosis and there's no tenderness, I'm assuming, right? Okay, good. Basically, we're going to have you stand straight, lean back, go ahead and turn here, lean back, and this is checking for thorax range of motion, basic core strength, and we will have you hyperextend, lean all the way back if you can. Go ahead and straight up. I want to see you laterally bend, so I'll kind of this way and that way. And then we're going to check twist. Good. So again, just going to kind of check strength here. Lean forward. Okay. Extend back. Hyperextend if you can. Go ahead and lean to your right, to your left. I'm just going to kind of hold your shoulders and check for twisting. So go ahead and twist. Good. Overall, I've been basically palpating through all the range of motion checks. The joints all seem to be without any kind of deficit, but you know, we would check for any kind of redness upon viewing. inspecting, we would palpate for any kind of heat, ask about tenderness, and of course check and listen out for any kind of crepitus. Megan's only 30, she has very healthy joints, and I don't see any kind of deficits, and have never noticed any deficits as a whole. So we're going to move on to our neuro check. Basically, we're going to start off with our heel to toe gait checks. So you can go ahead and walk heel to toe. It's okay, like so. Good, and everything appears to be nice and straight with no deficits. We check the Romberg sign. So go ahead and stand a little bit forward if you can. You're going to close your eyes and put your hands down at your side, and I'm just going to kind of nudge you, okay? And that's a good sign. Essentially, if she was to be thrown off balance or have any issue, that would be a positive sign, and that would essentially mean that she would have some kind of cranial deficit, some equilibrium issue that may need to be further inspected. We're going to check for lower extremity, upper extremity movement. So essentially we want you to lean down, touch your quads, and kind of rapidly move. Yep. You can stand up. This is where we do our heel to shin. So you can slide the heels down past shins. We check bilateral movement on that. We'll have you close your eyes and do finger to nose with both sides. So go ahead and put your fingers out, touch your nose. Again, other side. Good. We look at the stereognosis, which is where we identify objects without seeing them. So I'll have you close your eyes and put your hand out. I'm going to put an object in your hand here, and you can kind of tell me what it is.
Square.
Okay.
Cube. A CV.
Okay. We can check the graphesthesia, which is essentially when she puts her palm out, and we can write something here.
K.
That is a letter K. We can check bilaterally with a
T.
It was a number 4, but it could have resembled a T as well. I think she's a bit distracted because the baby's crying in the other room, so we're going to try and wrap it up by moving on to the hard-soft check. So if you can, go ahead and close your eyes. I'm going to just check the upper extremity.
Hard.
Okay.
Hard. Soft. Soft.
Okay, so she was right on all of those. We're going to check position sense. So if I can, I'm going to have you close your eyes again. Put your hands out, kind of straight out at the camera, and point towards the sky. Well, just with your fingers, that's okay. Point down and straight out. Okay, good. So we will check vibration sense. Usually we'd use a tuning fork with this. This gives us about 5 to 8 seconds of vibration. So I'm going to have you tell me when it starts, close your eyes, when it starts and when it stops.
Starts. Stopped. Start. Stop.
Good. So that's correct. We're going to zip right through our deep tendon reflexes. We're going to check bicep first. I know I have a 15-minute upload time for YouTube, so we will blast through these real quick. Bicep first, of course. Try and do our reflex here. There we go. Okay. We're going to check the tricep, the back. I think we got a positive response there. We'll do the brachioradial, which is kind of the middle. Did I actually get you?
That felt weird.
We'll do the patellar, so we're going to have you sit up on the edge of the chair here. And we would do this bilaterally. I'm just going to check the one, have you loose dangle here. And as the reading says, if we can't get a positive response, we're going to distract her by having her look over this way. And then, yep, hitting her at the same time. Go ahead and have you check the Achilles, which is the back of the ankle. Check here. And we're going to assume that that was a positive response. We're at 14 minutes, so thank you very much, Mrs. Dowell. I apologize for the props, but hope that this will suffice. Thank you and have a good day.